Years ago, this woman we'll call Sue lost her husband, was living on a fixed income with 2 young children. She thought gambling could supplement her income, but after 4 years of compulsive gambling, she was broke.
It's devastating. It's devastating. It brings you to a point of wanting to commit suicide.
She lived with the hope she would win.
I thought, Meg, that if I won enough money, all my problems would be solved. And that has nothing to do with it.
There is research now that shows that gambling disorders are very similar to substance abuse disorders.
Psychologists and counselors with the Jefferson Parish Human Services Authority say oftentimes people have both substance and gambling disorders. Both report withdrawals, cravings, getting high, and relapsing. There is a genetic component, and people with alcoholism in their families are more at risk for gambling disorder. Studies show adolescent smokers, people with alcohol dependence, and gamblers have lower activation in the reward pathways in the brain. But there is treatment, and at JP Human Services Authority, it's free.
The triggers to gambling, as well as some coping skills to deal with those needs to gamble. Oftentimes, people that have gambling diagnoses have trauma in their past life also. So we'll deal with those underlying issues that feed into some of that gambling behavior.
Sue credits another group, Gamblers Anonymous, for being in recovery now for 22 years.
Everything I thought I wanted from gambling, I got from not gambling.
Like what?
Like I'm able to travel, I have money in the bank.
And her family at her side. Meg Farris, Eyewitness News.
And gambling problems can start in teens as young as 14 years old. Seeing parents gamble or playing video games can increase the risk of gambling later in life. And we do have hotline numbers for you to get help on our website, wwltv.com.